Narcotic-induced overdose has become the leading cause of accidental death in America. Accordingly, many public health officials have declared that the United States is in the midst of an opioid epidemic and that swift action must be taken to ensure public safety. In our recent Henry Ford project published in the Journal of Arthroscopy, we evaluated risk factors for continued opioid use following arthroscopic meniscal surgery. Meniscal surgery is the most common procedure performed in orthopedics, and therefore elimination of identified risk factors has the potential to decrease opioid use in a large number of patients. In this study, we evaluated 735 patients who underwent meniscal surgery between 2013 and 2017. Clinical records and state registries were then used to identify patients' opioid use pre- and post-operatively. Patients were classified as opioid non-users if they had not received any opioid medications in the 3 months before meniscal surgery. Patients were classified as acute opioid users if they received at least one opioid medication within 1 month preceding meniscal surgery, or as chronic users if they received at least one opioid medication within 3 months preceding meniscal surgery. Our results demonstrated that patients who were acute users, shown here in blue, or chronic users, shown in orange, were more likely to continue to use opioids beyond 1 month postoperatively when compared to non-opioid users, shown in gray. When looking at the relative risk of opioid use at time points postoperatively, we found that acute and chronic users were 3 and 8 times more likely to be using opioids at 3 months postoperatively. Acute and chronic users were 2 and 9 times more likely to be using opioids at 6 months postoperatively. Now, these results suggest that opioid use prior to meniscal surgery may affect the ability to control pain after surgery and increases the risk for continued use. Patients receiving opioids from multiple providers showed a higher risk of obtaining opioid prescriptions after the first postoperative month compared with those with a single prescriber. This suggests that patients who obtain opioids from multiple providers may continue to seek opioids postoperatively compared to others. The Outerbridge classification is an intraoperative classification system that details the amount of arthritis present at the time of surgery, from 0 being no arthritis to 4 being severely arthritic. Patients with an intraoperative Outerbridge grade of 3 or 4, shown here in gray, were found to consistently require opioid prescriptions beyond 1 month postoperatively, compared with patients with an Outerbridge grade of 0, shown in blue, or Outerbridge grade of 1 or 2, shown here in orange. Patients with more severe arthritis should be informed that they are at a risk for continued pain postoperatively, which may require continued opioid use. You can read the full article on arthroscopyjournal.org. I'd also like to thank all my co-authors and everyone that was involved in this project.